So if you're just now joining us today, you know the drill. Pull up a chair, pour yourself another cup, and let's find out from Dr. Jessica Baugh about chronic pain versus acute pain. First of all, Dr. Baugh, welcome to the show.
Thank you.
Your credentials show a PT, DPT. Now that's alphabet soup to a lot of us. What does that mean to you?
That means that I'm a licensed physical therapist in the state of Arizona, but I also have a doctorate in physical therapy.
So tell me, from your point of view, what is the difference between chronic pain and acute pain?
So for me and most of the therapy community, research may differ a little bit, but acute pain is someone who has new pain. So something that started maybe yesterday, recently, up to a few months, whereas chronic pain is something that's going to last for 4 months up to years.
In your experience, do people tend to wait too long before seeing a doctor when they have a pain issue?
I think we, in general, tend to say, oh, it'll get better, and we put things off when, you know, if you're having an ache, a pain, go get it looked at because it's easier to address it in the early phases.
Speaking of easy, have we kind of fallen into a trap where when we have an affliction or pain, we tend to say to a doctor, just give me a pill for this, when in fact there may be a longer lasting, more effective solution that maybe takes a little work?
We tend to have a society of instant gratification. So we have dishwashers now and fancy laundry machines and things like that, and it is so much easier to go into an appointment, get a medication, take a glass of water, take your pain pill versus go meet your physical terrorist or torturist, whatever you want to call us, and then get some horrible exercise program that you have to do every day religiously. So absolutely, it's easier, but as our society is transitioning away from that, which is more effective.
As a physical therapist, when someone comes to you and has a pain issue, what are some of the elementary steps you take?
So we are all different, and it's important to find a therapist that you feel comfortable with, first and foremost. So if you're watching this and you've had a physical therapist that maybe you love, go to them. If you don't, shop around. If you feel comfortable with your therapist, you're going to give us more information. But we tend to look at flexibility, mobility, balance. We look at the whole system. So if you come in with shoulder pain, we don't just look at your shoulder. And so we try to figure out what is causing it and not just fix that issue.
So describe for me the basic differences between a physical therapist and a chiropractor, or is there a difference?
There are pretty clear differences. There's a little overlap there. I know that physical therapists, we are known as the experts on movement, and we look at the whole body. We don't tend to manipulate, so that snap, crackle, pop, we don't tend to do, although we are allowed to. And then chiropractors tend to do that lovely manipulation and you get immediate relief, but the chiropractor generally isn't going to give you an exercise program or education to help down the road. Using them together can be a great tool. Now
during the rehab process, I assume sometimes pain medications are still used, right?
Absolutely, especially post-operatively. So if you have a knee surgery and you come in to see me, then I'm going to encourage you to take that pain medication so that I don't make you cry.
Speaking of crying, as we get older, a lot of us slow down physically. I know the importance, of course, of constantly moving to ward off weight gain, to ward off pain and stuff. But if you're in pain and if you're obese, that movement can be painful. So how important is it to keep that movement going to avoid overall stiffness and chronic pain?
So important. And I always tell my clients who say, I can't do my homework because I hurt. Well, if you hurt, you don't move because you need to protect yourself. You want to protect yourself. But if you don't move, you're going to hurt more. And so your therapist can work with you, especially if you're obese. Going and walking a half an hour may not happen, but maybe you can get up and get that glass of water every hour and start small.
So it becomes kind of a self-fulfilling prophecy, doesn't it? So tell me about the activities in chronic pain and acute pain management at Mountain Valley Regional Rehabilitation Hospital.
So we have wonderful tools at our hospital. We have home health, inpatient rehab, and outpatient. I'm one of our outpatient therapists, and we have a pool. We do hands-on therapy. We use things like ultrasound, electrical stimulation. Most people have heard of TENS. movement. We have a lot of state-of-the-art equipment.
And physical therapy, especially in seniors, of course, involves improving strength, flexibility, mobility, reflexes. All of these, I would imagine, too, are factors in reducing falls, right?
Absolutely. And for our population here, it's primarily elderly, and so fall risk prevention is the top of our list. And I love to look again at the whole. Are you having falls because you're just not paying attention to where you're going? Are you having falls because you get up at night? Is your cane not the right height? Are you using it incorrectly? It could really be anything.
And sometimes that snap, crackle, pop is the sound of us getting out of bed in the morning, isn't it? That's Dr. Jessica Baugh from Mountain Valley Regional Rehabilitation Hospital, recognized nationally, healing locally. Stay tuned because we're going to talk about Alice the